Welcome to Module 2, where we're going to look at exercise dose and progression so that you can get the best health and performance results from the exercise you do. If you aren't doing any exercise right now, you'll learn how to get started without experiencing too much discomfort. This module assumes that you're familiar with the terms and definitions we described in Module 1, so if you haven't watched Module 1, please do so before continuing. Just as medications have a dose, so does exercise. But in the case of exercise, defining the dose isn't as straightforward. Exercise dose comes from the combination of frequency, intensity, time and type, and a couple of related factors. Just as with medication, some people need a higher dose of exercise to benefit than others. Similarly, some need a lower dose of exercise to avoid any negative downsides. Exercise tolerance varies from person to person and from day to day within the same person. We'll discuss some of the reasons shortly. Understanding a little about exercise dose will help you navigate between the problems of disuse, affecting so many people in our largely sedentary world, and the problems of overuse or even abuse that can crop up when we consistently push our bodies too far or in the wrong direction. Exercise dose can be seen in terms of a single session or over time. This diagram looks at dose from the perspective of one session. Being a stressor, exercise is something your body has to recover from. The greater the stress, the more time it takes to recover. At the extreme would be noticeable injury. Given a high enough intensity or duration, your body won't be able to repeat the effort for minutes, hours, or even a few days. With time, your body recovers, and if the dose of exercise was neither too high or too low, you'll actually get better than you were. This is sometimes called supercompensation, and just means that you'll be able to handle more the second time around because you'll be slightly faster, stronger, or have greater endurance. Assuming you got the dose right, the next deciding factor is when you repeat what you did. If you do it too soon, you short-circuit the supercompensation process. If you wait too long, your body will undergo something called detraining. This is such an important topic that it's worth looking at it in terms of frequency and therefore the cumulative dose over time. When the dose of individual exercise sessions and the frequency is well matched to your ability to recover, you can expect regular progress as shown here. When each bout of exercise is well matched to your ability to recover, but you exercise too infrequently, then detraining will rob you of much or all of your potential gains. It will be great if we can get away with exercising every few weeks and still improve, but our body is a little short-sighted for this. Fitness takes resources. When our bodies get the impression we don't need the added fitness, they put their resources into other survival tactics, such as accumulating fat in case of famine. What can I say? Our bodies don't always move with the times. An extreme but common example of detraining is the loss of muscle and strength that happens while wearing a cast, or otherwise being immobile. A less severe version affects anyone not regularly challenging their body with appropriate physical activity and exercise. When we're young, we're a little more protected from the detraining effect, but the older we get, the more important it is to encourage our bodies to maintain fitness, and thereby their physical function. On the other hand, if we do too much in one go, or as shown in this diagram, do an otherwise manageable amount too frequently, we won't recover fully. In this scenario, our bodies don't even finish recovering before being challenged again. Over time, they can get worn down. Those of us not obsessed with exercise are less likely to do a modest amount too often and more likely to start out by doing too much at once. So building up dose, as our ability to recover improves, we'll get around this problem. The graphs hopefully help make sense of the idea of exercise dose. There is an added layer of complexity though, best explained by a principle known as specific adaptation to imposed demands. Volumes can and have been written about this principle, but it basically says that you get good at what you practice. Your body specifically adapts in ways that make it better at dealing with the stress you expose it to, provided that stress isn't too much or too little. If you're training for a specific sport, think about what qualities that sport demands and pick your exercise accordingly. Or better yet, get the help of a competent strength and conditioning coach. If your goal is simply to build or maintain your health, then do some strength training and some endurance training. You can even do your strength training in a way that builds some endurance. It does pay to recognise that different types of exercise compete for limited resources. For example, doing endurance training before strength training reduces the effect of the strength training. Less so the other way around. You can think of this as exercise interference. Think of it this way. You won't find a top cyclist who also excels at weightlifting and sprinting. The qualities needed are just too different, and the training required to be a great cyclist would seriously undermine that needed to build the power needed by weightlifters and sprinters. Now, if you're new to exercise, this will be barely noticeable, as you'll have so much room for improvement, you'll probably get stronger and build endurance no matter what you do. As you get better in these qualities of fitness, you'll eventually need to decide what your priorities are. This is less an issue if you're trying to improve balance, flexibility, or coordination, as you can reasonably expect to, say, get strong and have great balance. So back to dose. The right dose of exercise depends on your exercise tolerance. That's your unique ability to recover after challenging your body by doing something it isn't used to. Acknowledging this is in no way an excuse for an inactive lifestyle, as being sedentary makes us less tolerant to exercise directly by creating an inadequate exercise dose, and by increasing the risk of disease that make us less exercise tolerant. Building up exercise tolerance requires doing exercise. Consider that time and again studies find that even very exercise intolerant people, such as those undergoing chemotherapy for cancer, people having dialysis treatment for kidney disease, recent victims of heart attacks or strokes, and those about to undergo life-saving organ transplants, and people with chronic fatigue, all benefit from appropriate physical activity and exercise. Your own exercise tolerance will vary day to day depending on factors such as previous exercise, how well you slept, whether you're ill, any medication you might be taking. If you're a woman, then where you are in your menstrual cycle. Less obvious factors that will influence your exercise tolerance are stresses you may not think of as physical, such as stress at work or at home, and stress from a less than optimal diet. Your medication may also reduce your tolerance to exercise. Then again, if you build your exercise tolerance by doing exercise, you may in time need less or no medication. To see if your exercise dose is matching your tolerance, go through this algorithm. Progress is seldom nice and steady, but it tends to be faster and steadier in the first few weeks to months of starting some form of regular program. If the algorithm suggests that you reduce your exercise dose, think about whether your recovery habits are matching your exercise habits. Are you getting good regular sleep, or at least trying? Is your diet supporting you? Given that exercise can both reduce and add stress to your life, have your stress levels recently increased? If you genuinely think that nothing else is getting in the way of your recovery, or you can see that it is but feel unable to change that for now, think about frequency, intensity, time and type. If nothing adequately explains a worsening in your exercise performance, and easing off or even having a few days rest doesn't address the problem, I suggest you seek some medical advice. On the other hand, if you're simply not making progress, but also not getting worse, maybe seek out the help of an exercise professional. Any one or combination of fit is up for change. Making big changes can create an illusion of progress, as you won't be able to compare back to what you were doing. Most of the time, you'll make the best progress by making small changes gradually. As you'll have noticed from the algorithm and discussion of exercise dose, while you naturally don't want to overdo it, you also don't want to underdo it. The healthy response to physical activity is to get better at what you're doing. That may mean getting faster, stronger, or being able to go further or otherwise do more. Even if your main motivation is improved health or fat reduction, you still need to improve your performance in order to reach your goals, at least to a point. A lot of people make good progress with exercise in the first few weeks or even months, so they keep doing what worked initially, but eventually it will stop working. Assuming exercise tolerance hasn't taken a nosedive, then a lack of progress means something has to change to increase the challenge enough for your body to respond by stepping up. In other words, if you want something to change, then change something. The next module of MOVE 101 will give you a greater insight into the types of exercise and how to understand a program you find online or in books.